I'm going to show you how to do Dr. M's average cast that comes in for a plastic device. We put all the angles into the cast instead of on the outside. So this is all going to be intrinsically posted, and I'm looking and I double check to make sure the doctor is asking for any extras to be put on here, and he just wants this done the normal way for a 50-year-old person. And this is going to be for one of our X15s. As you can see in the movie, sitting on a level table, got the 4 foot angled, and if I turn it upside down, you can see that this is this patient here was pronating. So now we're going to take and dissect the first metatarsal. And the 5th metatarsal. Of both left and right. Now it's a lot faster, and that's why a lot of labs are giving you half mats, office scanners with plastic tops, pretending it can do a 3D scan of the patient's foot. But in reality, when it comes in, it gives a measurement from the heel to the 5th metatarsal, from the heel to the 1st, and then it picks out a matching pre-made shape. Or the computer cuts it out with a milling machine. Now, in a lot of labs, they might stop, drive a nail in here, and keep driving the nail in the front until it's level. But I've been doing this so long that I'll do it with my eye and then check it with a level afterwards. Or they'll put a lot of loose soft plaster on the front, and they'll push it down on the table until it seeks vertical. And depending on how the plaster's setting up, and according to the Dr. Ruth book, you now cut off right to the red line that I put on. And I'm checking it now for vertical. And if I put my level on it, it is dead on the money. That is vertical right now. Double checking it again. It's about 1 more degree on there. While that sets up, I'm now going to fill in the lateral side. Of course, I am rushing this for the movie. I normally take a lot longer. So as we're finishing off the lateral side, which allows for the extra Spenco that's being added to this, just make it a little bit wider. So when we add the cushion top, which is no charge in our lab to put Spenco on, instead of vinyl. And I'm going to work it back to our support shaft. And again, this is all hand work. I'm following the contour of the cast. And Dr. M just wants it standard, which means I am going to fill in this arch area about 1/8 of an inch just to give a little play so it'll feel comfortable to the patient. If the doctor decides he wants to lower the arch, that's when I would add more plaster in the arch according to what you check off on the form. It might be somebody's grandmother who's old, a lot of arthritis in the arch, wants to keep the heel vertical, but fill in the cast. If the doctor asks for a heel spur, I would add some extra plaster under the calcaneal so there would be a depression in the plate. And this foot would be used to make an X14, 19, 8, 20, and the most used one is an X18 polyethylene. All plastic, which we would post the heel. Now when this dries, we'll follow up with the video on how we vacuum form the selective or plastic to go on top of it.